Welcome to the Authority File, the podcast where you'll hear conversations with academic librarians, technologists, researchers, and authors whose work is laying the foundation for higher education's future. I'm Bill Mickey, your host and the editorial director at Choice. If you're new to the Authority File, you can listen to and find previous episodes on most of the major podcast platforms, and we encourage you to sign up for our monthly newsletter, the Authority File Roundup, which keeps you updated on previous, current, and upcoming Authority File episodes. You can subscribe at choice360.org by clicking on the newsletter banner at the top of the homepage. My guest for this four-part series is Dr. Rebecca Cooney, chief editor of a new Nature journal, Nature Mental Health, set to debut in January 2023. Dr. Cooney and I discuss health equity in mental health, what that looks like from a clinical perspective as well as an academic one, and how the new journal will be addressing that across its entire editorial production process. This series is brought to you with support from Springer Nature. In this first episode, we're introduced to Dr. Cooney, her research, and Nature Mental Health's unique approach to inclusivity. Okay, Dr. Cooney, welcome to the program.
Thanks for having me.
Sure. So can you start by giving us a snapshot of your background? You just joined the Nature group this year, right? And what were you doing before this? And what's your research background and current research interests?
So I had previously been at The Lancet as the North American executive editor for about a decade. And then prior to that, I was the assistant and associate editor for Annals of the New York Academy of Sciences. So two very long, very old running journals. And then here now to a very brand new journal. And my background in research is specifically in mental health, and I did depression research and looking at sort of neural correlates of various aspects of depression and anxiety, and also transgenerational transmission of depression. We did functional imaging, and as well as other sorts of behavioral and cognitive assessments. And then I was also postdoc in psychiatry at Columbia University, and sort of extended that work more into the realm of psychiatry and the neural basis of obsessive compulsive disorder. So this new position has been an interesting sort of sea change in that it is brought me back full circle to where I started my research career and where I've been in the last 12 plus years. So it's really exciting to kind of see both what has changed and what hasn't changed.
Mm-hmm. So is that part of what attracted you to the position of chief editor for Nature Mental Health?
Yeah, I think for those of us who have been editors for a long time, you're really always assessing the opportunities out there of, whether is there a real need to establish a new journal in this area, but also am I a good candidate for that role, in that is there something different that I could bring to or a new viewpoint that I could add to how we have traditionally published work in this area. And so for me, what I felt like I could bring specifically was all of this experience doing general medical editing, and prior to that more general science editing, but also these themes that have emerged in the last few years that are really sort of changing the general conception of what we think of as mental health. And it was, during the pandemic, just this overwhelming deluge of papers coming in that were both, trying to keep us apprised of what was happening at the biological and physiological and virological levels, but also that there was something phenomenologically going on. And I think it really has been a lightning rod in tuning people's attention towards mental health and what might potentially need to happen differently in research. And really what I think that difference is to bringing more of a public health approach into that spectrum. And so when I found out that there was plans by Nature to launch something of this, I was really interested in how do we kind of break away from the traditional models of publishing, where psychiatry journals publish, more neurobiological bases of mental health, and then we have more psychological assessments and interventions and clinical aspects, but also public health sort of envelops all of these things.
Mhm.
And how could we have a journal that actually attempted to fold all of those together? So it's really just been both the intersection of work that I've done and been exposed to in my life, but then also watching that on a much broader scale, at the global level, of how these forces interact.
Excellent, excellent. So you're currently prepping the launch of the journal, right? If the first issue hits desks in early 2023.
Mhm.
Yep. So what have you been doing so far to get the publication ready?
Well, we went from this really golden time where we got to, think about what we wanted to do with the journal, and, really this planning stage. And, we're now in the 3 months before the journal actually launches, and the pendulum has really swung, and that it's time to, it's go time. And really, I would say what has been integral is having conversations with a lot of different people and who I would consider stakeholders. So
Mm.
really it's surfacing people who are early career researchers who are doing work in novel areas, or who are doing work that really espouses sort of DEI principles, and are looking at underserved groups of people, or people who are minorities, and seeing how we can bring those voices to the table that have
Hmm.
long been neglected, I think, by a lot of the traditional publishing establishment, as it's just, it's really been who and where the funding is. So how do we bring those people into the fold? But also doing a lot of commissioning around that, and
Hmm.
then also sort of our standard bread and butter, which is getting papers in, getting those papers reviewed, seeing what we can do to help revise them and get them in great shape. And I think one of the ways that we've really decided to make ourselves somewhat different is that we want to be a very high touch type of journal, which is that we're really working with the authors to improve the manuscript for transparency and reporting, but also in terms of readability,
Hmm.
because for a topic like mental health, there will be obviously people who are interested in a lot of these topics that aren't scientifically trained, or aren't mental health journalists. And so how do we make this a publication that is something that anyone could get good read out of.
That's interesting. So, with that kind of editorial strategy in mind, did that impact sort of your staffing needs in terms of how you staffed up for this publication, or?
Well, I think one thing that's really different at nature journals to a lot of other journals out there, is that there is no editorial board per se.
Mm.
It's staffed by all in-house editors, and so the editors are content experts, but also we have this really wonderful sort of result of just being able to recruit on an international scale, and
Yeah.
ended up with one editor who's in London. We have two in Berlin, but everyone comes from a different cultural background, and so brings that to bear. And then I'm sort of the only person in the US. But we also have varying types of expertise that
Hmm.
really, both in mental health and also with editing, that I think is going to be really useful. So I'm the only person on my team who actually speaks English as a first language. So just as we've sort of negotiated how things work in that way,
Right.
really being mindful of how just very small pieces of the editorial puzzle can make an effect on how easy something is to absorb.
Right. Exactly. Yeah. That's what I was thinking of when I asked that, is like, just the skills needed to sort of edit content for more of a what sounds like a general audience or a general readership than coming at it from a traditionally sort of academic approach, editorial approach.
Yeah, I think also beyond that too, the sort of way that the research journals are set up at Nature is that we do a lot of commissioning and
Mhm.
sort of the front half of the journal commissioning, and so that means getting people's voices in a more naturalistic way as well, which isn't something that, if you're just publishing papers and you don't have sort of those ways to communicate in the front half, and also doing an editorial so that we can really piece together the narrative of what sort of current events might be playing out that are
Mm.
or would be of interest to a lot of different groups.
Right, right. So you've explained a little bit of this, but it's sounding like you're planning a pretty unique editorial approach to nature mental health in the sense that you're intending it to be as inclusive as possible. Can you elaborate on what that inclusivity means in terms of how you're constructing content, topics, breaking out of editorial silos, for example?
Yeah, what was really interesting, I think, in kind of, you know, even coming up with the basic marketing materials of describing ourselves,
Hmm.
we had to think, well, what does mental health mean, and what are some of these really big concepts, and but then sort of drilling it down into what will be unique about this and how can it be inclusive. And I think just by dint of being called nature mental health, it's a much more inclusive approach than a lot of journals that are sort of one facet of psychiatry or a facet of psychology. And because of that, we thought, it gives us this incredible opportunity to kind of think of, health as this sort of broad construct is something that everybody has. And in the same way, mental health is a construct that everybody has. And there's obviously a continuum there. We want to be able to look at facets of interventions and sort of broad scale longitudinal studies of how do we promote and preserve mental health. And so that really veers into kind of the positive end of the world. And so, but it also speaks to concepts like resilience and, are we able to understand what prevents people from developing a mental health disorder? Or do we know how to protect mental health in certain situations and in certain settings? So on one hand, we want to be able to, be a place where people can publish on those topics, but then also to, the more traditional end of the mental health disorders world. And we're kind of finding this interesting sweet spot of a blend of both,
Hmm.
and then also to really incorporate that idea of public health in there. The other thing about inclusivity, so it's really a matter of kind of the who and the what. So the what of publishing, we've sort of been mapping that out, and also thinking about how can we translate that then into public policy, for example, or how is it translated into being something more clinically useful? But I think it's also looking at the who. So we want to look across the lifespan. We want to look at, all genders and sort of the representation of what we mean by gender, and then sex-based issues, but also groups that globally have been understudied and settings where people have traditionally been left out of the conversation. And then to also really help lower and middle income countries, or sort of in the global south, often overlaps with that a
Right.
lot, but to get more people involved in the authorship process and in the reviewer process. I would say the reviewer process is really one of those areas where there's a lot of movement that a journal can actually initiate. So we're trying to really push on all of these various aspects to kind of get to this idea of a more inclusive journal.
You just heard from Dr. Rebecca Cooney, chief editor of a new nature journal called Nature Mental Health. Join us next week as we explore what it means to achieve equity in mental health. This series is brought to you with support from Springer Nature.
I think that when we're talking about health equity and mental health, we have to kind of revert to looking at, well, what's the difference between equity and equality?
Mm.
And in the
Right.
sense that, I would say that we don't have in the US really a functional system for mental health access and delivery of care. And that's really, it's an issue of mental health parity. So even though we have healthcare plans that may have some provisions for mental health, they don't have the same sort of, guidance of this is what constitutes a mental health care plan per se. And so the issue is that if we looked at something from an equality lens, we could say, sure, there's inequalities, but also we may be sort of equal in our mental health, and that there is very little provision for care. And in some places where there's simply no provision of care, then they do have, in some sense, mental health equality. So it's not always a useful way of sort of looking at where things stand.
As always, underwriting opportunities for the Authority File podcast are directed by Choice's advertising manager, Pam Marino, and all of our episodes are produced and edited by Choice's digital media producer, Sabrina Kofer, with support from digital media assistant Ashley Roy. That's all for this week. Thanks for joining us.